What's up, guys? Today we're going to talk about health insurance. This is just all the different types of health insurances that are available that you might see. I'm not going to go into about billing and stuff like that because that's not going to be on the NPTE. I know how to bill, but I'm not going to definitely go in depth on that. But I'm going to be talking about just the different types of insurances. What do they mean? What do we might have to do differently with them? And then we will go from there. So here are the different types of insurances. So we have our private insurances. That could be anywhere, whatever anybody's doing. And then our independent health plans is our HMOs or PPOs. So I will talk about that in just a little bit. And then our government health plans, which I feel like is more what the boards kind of focuses on because these are going to be specific to if it's they're not specific per each state. Like every state's going to have these. So you'll be able to see some of the differences between these ones. So let's talk about private insurances. So these are stock companies, mutual companies, or nonprofit insurance plans. This is like whatever, like there are so many different ones out here. We could get into like grand depth about this. A lot of the private insurance companies end up having HMOs and PPOs as well. I just really wouldn't worry about this too much because this is just your generic non-federal insurance, can treat multiple ones at the same time. It is what it is. Again, these are probably things that people get from like Marketplace or something like that. So independent health plans, again, these can be a subsection. They can be either non-federal insurance or federal insurance. So it's basically managed care. And so this is where the person is able to see individuals who are credentialed by that insurance company. So whatever's in network, this is either a PPO plan or an HMO plan. So just for utilizing an example, my health insurance is UPMC health plans, University of Pittsburgh Medical Center. It's like all throughout Pennsylvania and it's creeping into other states as well. And so I have a PPO, so I'm able to choose who I want to go to. So that's what a preferred provider organization is. So I have a list of individuals who I can, well, it's not even a list. It's just I can pick who I want to go to. So like the therapist that I see, I can pick, I go to her. If I need to see a PT, I can just pick who I want to go to as long as they're, in networked. And so again, you can still see people out of network, which is going to be more expensive. With an HMO, you can't see people out of network. Think of a PPO as like I make the decision of who I see, while the HMO is the health maintenance organization. That's you have a list of people that you can choose from. So with the preferred provider organization, as long as that person is credentialed, you can go see them. So like my therapist just moved to her own practice, and so she just got her credentialing through UPMC insurance. So now she can see me again. And if she was out of network, I would just have to pay the cash plan for that and attempt to see what I can get reimbursed by the company. But PPOs, those are ones where you can choose who you go to. Now, let's talk about my dental insurance, which is through United Concordia, and it's an HMO plan. And so, just using myself as an example for these. So, what that means is that I have a list of people that I could potentially go to, and I have to choose someone from that list, and I can't go where I want to go. So, I had to change dentists when I got on a new health insurance with the dental plan when I went back to school. And so what I had to do is I actually had to use the university's dental school because they were on the list of providers because the other provider that was listed was about 35 minutes away from my house. So I was like, I'll just go to the dental school while I'm out at Pitt for my lab immersions. There we go. By the way, PT Elevation is not affiliated with the University of Pittsburgh whatsoever. But anyways, with HMO plans, they're usually going to be less expensive than a PPO plan because again, if you want more freedom to do what you want, you have to pay more money. That's how I like to think of it. So with an HMO, you have to pick from that list of people on there. So my dad's insurance was an HMO plan, so he had to pick from that list of people who he can go to. And so you must also receive a referral to go to another provider. So this is a referral system. So instead of you self-referring, you have to get a referral from your physician. So that's why a lot of people, if they want to go to physical therapy, like my parents' insurance, it's an HMO, they have to get a referral from their primary care provider to go to therapy. Even though they know exactly where they want to go and who they want to go to, they have to just check that they're on the list of people and then go through there. So that's kind of the difference between an HMO and PPO. Think PPO, think pick. Like I get to pick who I go to. And then HMO, think the M is just mandated. Like you have to pick from this mandated list of people. And that's how I remember it. But again, for either one of these, even if you're on an HMO plan, if you have a hospital, like an emergency, and the nearest hospital is not in network, they will still help pay for it because you're having an emergent situation. Like, oh my gosh, how dare you like have your leg cut off? Like, across the street from a hospital that's not in network, you should definitely go to the one that's like 30 minutes away that's in network. Like, no, it's emergent condition. Now, if you're like, I have this weird ingrown toenail that might become infected, you kind of do have to go to the one that's in network. So I hope that that helps make the like a good understanding of the difference between the two plans. And if you're listening to this on the podcast, I do have a video of this on YouTube. So that's going to kind of show it all at once. So let's talk about the Medicare plans. I would definitely know the Medicare plans. Like I think of like all of the different health insurance questions. This is going to be the most important because the populations that most of us end up seeing are patients who are over 65. I know a lot of you guys are like, but I want to work in peds. That's great. A lot of the people that you'll end up seeing like in a clinical setting, when you don't have a choice of where you like work, will end up being over 65. So most of them will be on Medicare. So actually, here's a fun fact. You cannot get Medicare unless you have worked in the United States for 10 taxable years, which is technically 40 quarters of, taxes that you have to pay. So if you're somebody who, you work for like 3 years and then, you become a stay-at-home mom, and then you end up not going back to work until like ever, and you just work part-time and stuff like that, or you don't work at all and it doesn't add up to 10 years, you can't get Medicare. So that's where a lot of people run into some problems. So that's why we want to make sure everybody has their 10 taxable years of working in the United States. And that can count as like when you were working in high school, like at like Chick-fil-A or something. All of it counts. But anyways, some individuals are dual eligible for both Medicare and Medicaid. We'll talk about Medicaid on the next one, but let's talk about the different parts of Medicare. So we have Part A. And so anybody who, falls under that, we worked for that 10 taxable years in the US, you automatically, and this is US citizens too. I'm sorry, I wanted to make sure I clarified that for US citizens. And then anybody, basically, as long as you've worked, you get enrolled in Part A. So Part A will cover hospital stays, skilled nursing for certain periods of time. Sometimes there's a cap on how long they can stay, like maybe it's 100 days. It depends on what Medicare feels like that year, but it's different per year. Hospice services, and then some home health. So home health can sometimes be billed under Part B, which that one you have to enroll in. So everybody automatically gets A, but not everybody can get the rest of them. So the other ones you would have to pay for. Like my grandma has Part B and Part C. And so she would pay like $150 premium a month to have those, which a lot of individuals, like, if they're retired, they're on a fixed income. So you might not see people have all of the different parts of Medicare. So Part B, you have to pay into, it's extra, so it's on top of it. Part A, you don't have to pay into that. Well, you're paying into it your whole life when you pay federal taxes. And so Part B will cover outpatient services. So if you work an outpatient, you're mostly going to see Part B. So you'll have all that stuff. So any sort of outpatient services, either from PT, OT, going to a sleep center for a sleep study, getting a cardiac stress test, all of that stuff is outpatient services where you're not staying overnight. Durable medical equipment. So if you need to order a wheelchair for a patient, or you need to order them an assisted device or orthotics or something like that, all of that's going to fall under Part B. So all those medical supplies and equipment, and then diagnostic tests and imaging. So getting an MRI or getting a CT scan in an outpatient center, all that's going to count under Part B. Now, Part C, a lot of this might be referred to as a Medicare Advantage plan. So you might have seen commercials for it or heard somebody talk about it. A lot of patients end up having this because essentially it's just going to cover all the bases that they want. So they just go through and they just check the boxes of like, do you want vision? Do you want hearing insurance? Do you want dental insurance? Like all that stuff. Again, they'll just pay an extra premium. And so it kind of combines a lot of the stuff in like Part B and Part D that they might be missing. So that's what's going on here. So like my grandma pays for that one and she'll get her vision and dental insurance through there. Yeah, isn't that crazy? And so that's how that will work for Part C. And then Part D, think drugs. So this is going to be all of our medication and prescription drugs. Again, they'll have to pay a premium to go into this. There's a whole other bit for Part D, but this is going to get you like 95% of the way to answering the question, right? So we're just going to keep it simple. So again, Part A, hospitalized, everyone gets A. Part B, outpatient services and durable medical equipment. C, covering the rest of the bases. That's what I like to think of. That's the Advantage plan. And then D is drugs, though that's how I remember those. So let's talk about Medicaid. So it's funded by the state, so state to state. So I had a friend who well, like we're all in PT school, so a lot of us don't work. I mean, I have PTA elevation, so I don't qualify for Medicaid because I'm generating enough income. But a lot of my classmates, they don't work, so they're not generating income. So it basically says that they make no money, so they were eligible for Medicaid. So one of my classmates moved from New York to Pennsylvania, so she had to switch from having Medicaid in New York to having Medicaid in Pennsylvania. So it's different from state to state, but the qualifications for Medicaid are pretty much equal state to state on what they need. So low income or need public assistance. So again, if you're working in school, you're not making any money, so it'll automatically say that you're eligible for this. But again, these are more of our lower income individuals. And so anybody who's eligible for like food stamps or something like that, or any sort of other medical assistance, that's all going to be under Medicaid. And so you can be dual eligible for both Medicare and Medicaid. Some individuals under 65 can be eligible for Medicare as well. I just want to mention that if they need some sort of, if they're disabled in some sort of way. So one of the patients that I treat, he's actually my age, this is very sad. He has ALS, so he's so severely disabled that he actually qualifies for Medicare as well. So just interesting facts. It's not just everybody over 65, but Medicaid can cover anybody at any age, anywhere, even though Medicare is mostly for over 65. So if you want to, a good way to remember the difference is I always think that Medicare ends in an E and then Medicaid ends in a D and E comes after D. So I think E is for the older people. That's how I remember it. Someone also said E for elderly. Whatever works, man. Whatever works. There's other ways you can remember that. I did find a more almost derogatory way to remember it, but I don't want to say it here because that's kind of rude. But anyways, so Medicaid is going to cover a wide variety of services. So pretty much everything that all those Medicare plans cover, Medicaid is going to cover all of those things as well. But they also might need some limitations on how much that they can cover. So again, there's probably limitations on how long you can stay in a SNF or if you're eligible for inpatient rehab, stuff like that. But I'll cover inpatient, outpatient, SNFs, preventative health services. So going for your annual checkup, home health, diagnostic services like an MRI or something like that. And then physician services, like if you need to go to a dermatologist and get a mole removed that's precancerous. So Medicaid just think Medicaid, state funded, still federally funded, but it's going to be by the state instead of the whole government. There's things allocated. It's a whole thing. But anyways, Medicaid going to be for more poor individuals or low income individuals. Now, CHIP is going to be a type of Medicaid kind of service similar, but it's going to be state funded, but it's for children. Okay, so we had a patient once that would call every child a little chippy. And so now I refer to all little kids as chippies. And so that helps me remember that CHIP is for kids. You can also think CHI, children, CHIP works better. But it's a whole acronym, but don't worry about it. So it ensures that all children are able to get medical coverage regardless of if their parents have it or not. So normally, if I wanted to, if I had a hypothetical child, I could put them underneath my insurance since I have UPMC health plan. Let's say that I didn't have insurance, but I had a child, I could still use CHIP to help get them covered. So it's still federal insurance to ensure that all children have access to medical services. And so that's why it was created. Now, workers' compensation is we're pretty familiar with this if you worked with anybody in outpatient ever, especially if you've ever worked at a consenter or something like that. So it's going to protect workers on the job if they are injured. So it's going to pay for their medical expenses if they are injured. So I have to pay for workers' comp insurance to the state for their federally funded for the state and everything. So it depends on the size of the company though, or the designation of the company. So for them to provide workers' compensation benefits. So in Pennsylvania, I believe it's 14 or more employees. Some states it's like 10 or more employees. You are mandated by the state to provide workers' compensation insurance. PTA Elevation LLC is filed under the S Corp tax designation in Pennsylvania. So I have to pay workers' compensation taxes on a quarterly basis, or else I get in trouble. But I pay my taxes, so we're good. So stuff like that is where the workers' compensation insurance money comes from. But essentially, what we need to know as PTs and PTAs and whatnot, we just need to know that they're under workers' comp insurance and to file things under there and to make sure we're documenting that we keep it more work related versus their hobby. So again, that's kind of how workers' comp works. And then let's talk about our sample question. So a physical therapist assistant would like to order a single point cane for a patient in a skilled nursing facility. Which of the following Medicare plans would obtaining this device be billed under? 1, Part A, 2, Part B, 3, Part C, or 4, Part D. So I'll give you guys a second to think about that one. All right, guys, so it's going to be billed under Part B. So even though this patient is in a skilled nursing facility, which would be covered under Part A, because that's an inpatient service, getting the cane for them is a piece of durable medical equipment. And so that would be billed under Part B, okay? So that's the difference, because that's durable medical equipment. So canes, wheelchairs, rolling walkers, all that stuff. It wouldn't really be C because it's specifically durable medical equipment. And then it wouldn't be D because that's drugs. So yeah, Part C on the boards is probably going to more be for those things that are extra, like dental, hearing, all of that stuff. So yeah, that's our answer for there. So I hope that this made health insurances make a little bit more sense, especially in the scope of the boards, because it's so different between clinical practice and what the boards ask about insurance. But I hope this was helpful, and I'll see you on the next one. Take care, friends.